step right after cleansing that you should be applying to your skin? Just a pearl size amount. Any redness or irritation or downtime required?
That is a great question. People say, well, what are the side effects? How will I know it's working? What will I experience? A little bit of tingling you may notice. You may notice even a little bit of heat, just a very, very minor bit. Usually, for the most part, people really don't have any adverse effects.
I didn't notice anything.
If you notice a little bit of dryness and flakiness, you may, if you're in a dry environment, I'm very, very comfortable with that. That's testament to that increased surface cell turnover that we're seeing.
Okay.
Doesn't bother me in the slightest. You'll acclimate to it, and you should continue using over time because the results are great right away. The studies show that right away, but it continues to work continuously over time.
Beautiful. So promoting cell turnover, and this is about a 60-day supply?
This is a 60-day supply.
Right.
Why is that important? 35 to 57 days is the adult cycle of the human skin. So by the time you're done with one bottle, you'll absolutely see a result. And what people say to me, well, are people going to notice that are they going to notice that I'm using something, accuse me of using something? I say, look, most people say to my patients who use this, they say, you know what, you look different. Did you get a haircut? You look well rested. They give you compliments, but they're not really sure why. And it's because you don't look like a different person. You look like your same self, just a more rested version. The diminishing of those fine lines and wrinkles is what makes them notice.
That is fantastic. Is there anything in here that will also help with, say, dark circles? Or?
Well, it has been indicated for fine lines and wrinkles. And I'll tell you, I have a lot of people who notice other anti-aging benefits with it. But for the most part, it's really those fine lines and wrinkles that are the biggest complaint of people during the aging process. And that's the #1 thing it works on.
You know, you can almost assume that, not assume, but you wouldn't be surprised maybe if other benefits followed?
Oh, I think that's 100% the case.
Yeah.
And, I mean, the thing, too, is that it's one thing to get an opinion and listen to the show and hear you and I talk about it, and, you know, I use it myself every single day, but 2,800 publications show that stabilized retinol technology is an imperative part, gold standard in any anti-aging regime. It's not 2, that's not 3, 2,800. So ask your dermatologist, ask your friends, your family members who have great skin. They're probably using a stabilized retinol technology.
Great. Can you use this, Dr. Kirby, on problematic skin?
In what sense? Sensitive skin?
Acneic skin?
Well, you can use it on. It is approved for all skin types, even for the most sensitive of skin. Now, it's not used to treat acne per se.
No? Okay.
But if you're having both breakouts as well as the signs of aging, it certainly can be used on that.
Okay. It's not going to exacerbate the problem.
Oh no, not at all.
Okay.
And in fact, like you said, if you have what types of skin can it be used on? It is indicated for all skin types, even the most sensitive of skin.
Excellent.
That's where people have more questions. They say, oh, I have very, very sensitive skin. I can't tolerate anything. In that case, you may need to use a little bit of a moisturizer with it.
Okay.
If you have an oily complexion like I do, you don't need to use a moisturizer. But if you need a moisturizer, you have a moisturizer you like, wonderful. I'm happy for you. Use it with a moisturizer. That's a great way to use it.
Excellent. Well, we just have about 2 minutes remaining. Excuse me, if you are just tuning in, Dr. Will Kirby joining us today, and thanks for making us a part of your Sunday. You're watching Canada's only 24-hour shopping network, the Shopping Channel. My name is Carol. It's really exciting when we can bring you a product that you can't get anywhere else in Canada, and it's backed by popular demand. It's from the Neutrogena Dermatologics line of Neutrogena. It's called the Retinol NX Serum, 29 mils, a 60-day supply. Why? Because skin cell turnover is anywhere between 35 to 55 days.
Exactly.
This is $75 for this 60-day supply. 3 payments of $25, and it is the marriage of 2 ingredients that makes it such a success, that proves that the product delivers results. And we're talking about stabilized retinol and tetrol E.
You just summed it up so perfectly. There's almost nothing more that I can say to improve on that. Other than that, I can bring it. Well, I can bring a personal message here. I'll talk all day, but if you come to my office in Beverly Hills, people come in there every single day and they say, Dr. Kirby, I'm frustrated. I don't know what to use. There's so much information out there. Here's a sack of products I use. Can you show me what works and what doesn't work? And I say, you tell me what works. If it's not working for you and you brought it in and it's been in your medicine cabinet for 6 months, 2 years, 10 years, it's not working. At that point, throw it away because it never was going to work, or it has long since expired. The time has long since passed since the ingredients were efficacious. So choosing the right product doesn't have to be confusing. It can be very simple. Anti-aging regimes start with stabilized retinol technology.
What is the shelf life, by the way?
Well, this will if you should use it every single day. So it's 60 days. But if you keep it sealed, and because the top clicks closed so that air doesn't enter in there, it can last. I'd be telling tales out of school, but I imagine it can last years.
Okay.
Now, I don't want people to use it that way because it continuously works, and if you apply a tiny little bit every single day, so you should be blazing through a bottle every 60 days.
Exactly, yeah, it's cumulative, so make sure you do use it, okay? Thank you so much.
Oh, the pleasure was all mine. Great working with you again.
You as well, Doctor. Take care of yourself,
and
love to the little baby.
Thank you.
15 and a half weeks. Oh, you must be just a little pudgy bundle.